Hi there, I'm Jack.
And I'm Matt.
And this is the MindKeepers podcast.
We are an educational platform with the mission of guiding people to take the first step to addressing their mental health.
Your GP. Football is coming home.
I'm just in a good mood today.
Hello and welcome to episode 4 of the Anxiety Explained series. Today, myself and Matt of MindKeepers are going to be talking about panic disorder and panic attacks. So today we're going to be providing a definition of what panic disorder is and what a panic attack is. And what the difference between the two actually is. Then we're going to be talking about the symptoms of a panic attack, how does it feel, and also how long a panic attack can last for. Then we're going to touch upon some of the causes of a panic attack. And then finally, we're going to round it off with the treatment options available and how to stop a panic attack in its tracks if it is occurring to you or to someone else. So really excited for the pod today. Matt, of course, as we do with these podcasts, should we start with our numbers?
Let's start with the numbers. So to give everyone a little bit of context about the numbers, every time me and Jack catch up, we score ourselves from 1 to 10 on a scale of how our mental health is at the moment. 1 is I'm absolutely dreadful. I think if we ever are feeling ones, we would stop the call immediately and focus on the other person. If you're 10, you're on top of the world, looking down on creation and ready for anything that life throws at you. And it's just a good way for me and Jack to gauge how the other person is feeling with their mental health. So I'm going to start. I am an 8.
Oh, good number.
I'm an 8. I feel good. I feel as though I've had a bit of holiday, 2 or 3 days off going into a weekend. So it's a Saturday today and I'm feeling as though I'm fully refreshed and I've still got 2 days left. And I'm just in a good mood today. 8s are brilliant, I think. I think that if you're ever a 10, you need to have a look at potentially the substance that you've taken to make you onto a 10. I always laugh and say to Jack that I think a 10 is unachievable, but he's a little bit more, optimistic about it. But I think 8 for me is as good as it gets. So yeah, brilliant. I'm an 8. What about you, Jack?
Well, glad to hear you're an 8, mate, and glad to hear obviously you've had a good week off as well. I'd say I'm a 9. I'm not going to lie. I'm feeling good. I'm feeling really good. Like I say, a 10 is achievable. I'm not quite there, but likewise, I've had a really good week off, seen some friends. Life feels like it's getting back to a bit of normality now with things opening up. Obviously, I'm wearing my England top. Football is coming home. Buoyed on by the Euro feel-good factor as well. Feeling happy and healthy. And yeah, looking forward to doing this podcast today. So yeah, I'm feeling like a 9. You know what, Matt? That's an average score of 8.5. I think that is our highest average score so far.
That is a brilliant score.
We're having a good time.
The great thing about it is the reason why we do it as well is because it represents what we know about mental health, which is that it's not a straight line thing. Yeah. Your mental health can peak from one day to another. You can have dips, you can have really good times, you can have ups and downs. And I think it's really great when we do the numbers, because sometimes we come on here, don't we? And they're not 8s and they're not 9s. They're 6s and they're 5s and they're 4s. And that's all part of mental health.
But that's the thing. Now we're an 8 and a 9. It's about living in the moment and enjoying the feel good factor that we have at the minute. So we'll pause and just soak this happiness that we're feeling, right now. It's a good time, and hopefully this podcast, I suppose, reflects the buoyant mood that we're in, Matt. And it's a good quality podcast for a lot of people to learn from, and a lot of knowledge for you all to soak in. So yeah, should we crack on then, Matt? Should we start delving into panic disorder and panic attacks?
Let's do it. Brilliant.
Okay, so first and foremost, we will start off with a short definition of what a panic attack is. You may, of course, have heard of a panic attack before. You may have actually experienced one, or know someone who's experienced one, or spoken about their experience with panic attacks. So panic attacks are quite a frightening experience, with a plethora of symptoms as well. So a panic attack is the most severe form of anxiety. And it is a feeling of sudden and intense anxiety as well. So we've spoken previously about anxiety with a plethora of symptoms which potentially are quite mild, but the differentiator is with a panic attack is that the anxiety and the symptoms that you feel can be particularly intense and is an exaggeration of your body's normal response to danger, stress, or excitement. So despite how frightening that these panic attacks may be, they are to what the person experiencing that panic attack. It is very important to try and rationalize the experience and understand that they are not dangerous to you, and they will not cause you any physical harm. As we say, it is a reaction, your body's reaction to potential danger, stress, or excitement, but it will not cause any physical harm. What do you think about that, Matt, in terms of a definition? And what do you think about panic attacks in general?
Panic attacks are scary. They're frightening experiences. And I think that definition really summarizes the intensity of a panic attack. Like I say, it's almost that exaggeration when you feel some sort of danger, when I always try and reflect on or think about when when the last time you were really scared of something, and you kind of times that by 10, and that's how sometimes a panic attack can feel. And I also think it is important that when you look at rationalizing the experience, understanding that, you're not in danger, you're not going to get any physical harm come to you off the back of a panic attack as well.
Yeah,
But
yeah. It's quite an interesting one, isn't it? Because it's like your body's natural response to danger. It's like you go into fight or flight mode, don't you? It's you're experiencing that stress and your body is reacting to it, and it's causing all of these really intense symptoms which make you feel even more anxious about what you're going through as well, and it's quite uncontrollable. So yeah, I mean, I've seen people have a panic attack. I've experienced one myself. It's not a nice thing at all. In terms of, we're talking about panic attacks and also panic disorder in this podcast. So it's important to distinguish as well between what the two of them are. So
definitely.
Many people will experience a panic attack in their lifetime. They may even have a few. Although they're not nice, like we say, the issue will usually go away on its own. But with panic disorder, it is the diagnosis that may be given if you are having regular or frequent panic attacks, so without a clear cause or trigger. So panic attack, plural, is essentially panic disorder when you're having them on a frequent basis, whereas panic attacks, singular, is just where you might have the one-off panic attack every now and then. And we'll touch upon this soon as well, but the regularity and frequency of the panic attacks will depend on the severity of the condition as well. So for some, a panic attack might occur once or twice a month, while others on the other end of the spectrum may have them several times a week as well. So yeah, that's the difference between a panic attack and a panic disorder. Nice. I think that nicely wraps up what a panic attack is, what panic disorder is. So Matt, maybe we can talk about some of the symptoms of a panic attack.
Definitely, there are a number of intense mental and physical symptoms that you might experience when you're having a panic attack. There's a list here which I will read out to you, as I am really good at reading out these lists, as we know from previous podcasts.
Well done,
So
Matt.
you've got things like a racing heartbeat, feeling faint, dizzy, or lightheaded, feeling that you're losing control, sweating, trembling, or shaking, shortness of breath, and breathing very quickly, a tingling in your fingers or lips, and also feeling sick, also known as nausea. And then this can also be exacerbated by the feeling that you're potentially losing control, going to faint, having a heart attack, or even going to die. So there's a lot of not nice things to experience when you're going in there. Some quite nasty symptoms, really, of a panic attack.
And what we've said previously as well, because of the severity of some of them symptoms, it can really be quite an unpleasant experience and makes you think that you're having something more severe than a panic attack, and having some kind of physical problem itself. So yeah, some really unpleasant ones there.
And I think that is a thing, isn't it? It's kind of, a lot of them symptoms are really horrible things to experience, and you don't know what's going on, you don't know what you're feeling. It could be a number of different things that you feel like you're having. You look there, feeling like you're going to have a heart attack when you're having a panic attack. It must exaggerate it a lot, so it's not nice to experience.
Not at all. Not at all. I mean, from personal experience, I've had one panic attack in my lifetime. One panic attack, and it was horrible. I was at the gym actually. I just had off the back, looking at it now in hindsight, off the back of a stressful period at the end of second year of uni, and the symptoms I had were tingling, in particular in the lower part of my body, in my legs. I also had a shortness of breath. So I was breathing really quickly, got really dizzy and lightheaded, and my heart rate just went through the roof. And it felt like I was having, because I was losing control, as we said about them feelings that can exacerbate what you're going through. Thoughts are racing through my mind. So I was thinking I was having either a stroke, a heart attack, something like that. I felt like something physical was really wrong. And it's so unpleasant. I remember being sat in the car with my mum, and I just had tunnel vision. It was like my I don't know, my eyes just went really odd. I had this intense feeling in my head and in my chest, and I thought I was about to die, honestly. And then it only takes 5-10 minutes after to calm yourself down, to then go through and rationalize that okay, that was actually a panic attack. That was my mind telling my body that I'm under stress and I need to do something to kind of to chill out now. So really horrible symptoms. And I don't envy anyone that has panic disorder or has to go through panic attacks.
I can relate to you as well. I've had a panic attack in the past as well, and I've had exactly them feelings. Racing heartbeat, really thumping, racing heartbeat, not knowing what was going on. I felt I was sweating, trembling, and I was shaking, and again, shortness of breath as well. So, and it's that expression there of feeling that you're going to die. It's not that should, it's unusual that should roll off the tongue and be so relatable, but it is so true with the panic attack. I think you do feel like that, and I certainly, it was a scary experience, and I think I actually went to A&E because I didn't know what was going on. I didn't know what was happening to my body. I didn't know whether it was something more than a panic. I didn't even know that it was a panic attack. I think it was just a really scary experience.
Yeah.
And they linked me up to heart monitors, they done some tests, they did blood tests, and it all came back as, well, nothing shows anything horrendous here. They're doing all the from a how your health perspective, you're okay. Then we look down the route. Well, actually, was it a panic attack then? And yes, it probably was. So it's
how did that make you feel when you were in hospital though? And because like you, I went into the hospital that evening because I'd thought there was something going on with my ticker, and likewise I'd had I think they call it I can't remember what it is now when they check your heart, like a trachea something. They plug you into that and then they check your bloods. And I actually felt a real sense of kind of shame and a bit of guilt that I'd wasted the NHS's resources, if you like, by going in because I'd had this panic attack earlier on in the day, and I actually thought there was something physical wrong with me. But the thing is, because I wasn't aware of what a panic attack was, I wasn't to know better. So how did that make you feel when you went into hospital as well?
Yes, scared to start with, because I didn't know what it was that I was experiencing. So it's kind of that thing of you kind of have to go, because if you don't go, you're not going to know what it is. And actually, if it is something else, then you'll know. Then it could be something a lot worse, couldn't it? So I think I felt relieved when I knew it wasn't anything to be necessarily scared of as anything really serious, other conditions. But it was mainly just a feeling of, Christ, what is this? I think it was more being miffed at, Christ, what on earth is this that I'm experiencing? It was the biggest thing that I felt was, and then when I then found out, I had follow-up tests as well, which is so it kind of prolongs that feeling of not knowing what it is,
Yeah.
which I think makes you a little bit worried and anxious in yourself, doesn't it? So as a result of that, so I think it was just a bit of an uneasy time until I kind of knew for definite that it wasn't anything along the lines of my, it wasn't a heart attack, it wasn't anything like that, and then I kind of felt relief.
Yeah.
But yeah, it's an interesting one that you said you felt almost ashamed, because I feel as though if you think that you're going to die, the first place you're going to want to go is a hospital. So I suppose guilt is just, I can see why you might have felt that, but I would have said it's more important that you went, because you wouldn't have known, would you? And then that would have made you more anxious.
Exactly, because then what if you went and it was potentially a heart condition kind of thing? This is the thing that we've discussed previously as well, Matt, is that your mental fitness is just important to understand, as your physical fitness and your physical health as well. So understanding that you may have had a panic attack, knowing that just happened, is just as important as knowing if you just had a heart attack. Because then if you've had a heart attack, you know that you need to look at your diet, you need to exercise probably a bit. Whereas if you then know if you've had a panic attack, that's your body telling you mentally you need to do something to mitigate this. So it told me, all right, I need to chill out, try and de-stress. So yeah, like I said, initially I felt a bit ashamed that I'd gone into hospital, but then I also had that relief that you said about that, that it is something that's being caused mentally. So then you know how to treat that and how to mitigate it. Yeah. And it's just important as well, when we're going to go onto the causes in a second, but just to quickly say that it's important to be aware that many of the symptoms of a panic attack can be symptoms of other health conditions as well. So like we said, me and Matt went into hospital because we had these symptoms. So it's probably a wise idea to do the same, because it could be something that is caused by a physical condition. So for example, tingling in your fingers or lips could be a sign of diabetes, and having a racing heartbeat could be caused by very low blood pressure as well, for instance. So it's always important to try and nip it in the bud as soon as possible before it mothballs onto something even further as well. I've just forgotten, actually. How long does a panic attack last? So we've done the symptoms. Most panic attacks last 5 to 20 minutes. Some have also been reported to last up to an hour as well, according to the NHS. That must be horrendous, and up to an hour. So the number of attacks you experience also depends on your condition as well. So if you do have panic disorder, and like we said, you could experience them several times a week or even just a couple of times a month. Matt, when you had yours, how long did it last, would you say?
Probably about 15 minutes, I think.
Yeah.
And then it's just the aftermath of not having a clue what you've just experienced, I think. So
yeah. Because were you still
the
quite
actual one itself.
shaken up for a bit of time after as well? Did you have some kind of residual symptoms after it happened?
Yeah, I think definitely. I think I felt a lot more heightened anxiety, a lot more anxious in general. So yeah, definitely. How about you? How long did yours last?
So mine was, I remember it was like a 20-minute spell from being in the changing rooms in the gym to about, it's like a 10-minute car journey home, having it the whole way back home, and then about 5 minutes when I got home as well. So it was about 20 minutes.
Yeah.
But that was when the symptoms were heightened. So that was like the severe kind of head pressure, palpitating, tingling. And then after that, it took me a good 2-3 hours for this kind of residual anxiety to phase out. So I still had a bit of tingling, still had a bit of like a jumpy heart rate. So, like it says there, most panic attacks last 5 to 20 minutes. I'd say the severe symptoms lasted for about 20 minutes, but the residual effects of the panic attack lasted for a good 2-3 hours as well. So yeah, it's quite interesting how it does differ depending on the individual.
Definitely.
Brilliant. Okay, so that's the symptoms of a panic attack and how long they last. So we're going to move on now to what causes a panic attack. What causes a panic attack? It's quite unclear what can cause a panic attack. Of course, it depends on the individual, but the NHS does suggest a combination of factors that may contribute. Now, the three of these include a traumatic or very stressful life experience, such as bereavement, having a close family member with panic disorder, or an imbalance of neurotransmitters, which are chemical messengers in the brain. Alongside them three, Mayo Clinic suggests that there are some risk factors as well that may increase the risk of developing panic attacks or a panic disorder as well. So like we just touched upon, family history of panic attacks or panic disorder, having that major life stress as well, like a bereavement, a traumatic event, such as maybe a sexual assault or a serious accident, major changes in your life, such as a divorce or the addition of a baby as well, smoking or excessive caffeine intake, and history of childhood physical or sexual abuse as well. So I think we can see from that it's very specific to the individual. There's no one size fits all approach with causes of a panic attack. Matt, could you signpost when you had your panic attack any kind of causes, or would you just feel that maybe it was completely random?
I would probably say caffeine intake's an interesting one. I was taking a lot of caffeine in terms of drinking a lot of coffee, and sometimes I would take energy drinks before I went to the gym, which sometimes I felt, so there's a lot of caffeine intake in there. And I'd probably say that's one of the main ones I experienced at the time. What about yourself?
For me, that's interesting you say about caffeine though, because that will come on to self-help techniques later on, I suppose, and having a healthy lifestyle. But I would say for mine, not like a major life stress, but a transition at that time. So I just finished my second year of uni, and exams. That was quite a stressful period, and I was just about to go on holiday with some of my mates, and I was about to start placement as well. So when I look back on it, I think there was just a lot going. It's the classic. There's a lot going on, and I felt a bit overwhelmed. I'd also run my first half marathon about a month before, so I'd put myself under some physical stress for a period of time as well. So when you add it all up, it's just probably classic me as well, doing too much at once and just getting a bit overwhelmed by it. So that I would say is why, because when I look at some of the other risk factors, I mean, I don't have a family history. I'm lucky enough that, I've not had any big historic kind of traumatic events as well. So I think for me at that time, it was just an amalgamation of different stresses that led up to that panic attack at that time. But it's interesting to see. And I suppose if someone is suffering from panic disorder or panic attacks, really delving into what may be the cause and the risk factors can help to keep the panic attacks under control. So it's important to know what them causes are. Super. So just to recap before we move on, we've given a definition of what panic attacks are and what the difference is between a panic attack and panic disorder. We've also touched upon some of the symptoms and how long a panic attack tends to last. And also we've spoken about what causes a panic attack as well. So next stop on this journey through panic attacks and panic disorder, we're going to talk about some of the treatment options and also how to stop a panic attack when it might be occurring. So Matt, we have some pointers of how to stop a panic attack.
So this is something. Well, first, I think it's difficult to stop a panic attack, but there are, I suppose, 4 methods that Mind, the mental health charity, recommend that you can use actually during the panic attack. So these are focusing on your breathing, so concentrating on breathing slowly in and out while counting to 5. Stamp on the spot. Okay, this can help control your breathing. Focus on your senses. Having a mint flavored sweet or even cuddling something soft could help. And also you can try grounding techniques. So grounding techniques can help you feel more in control. So there's 4 main things that Mind recommend there as actually during it.
I think you often see when I've seen dramatizations of like a panic attack, you often see that one of people breathing into a bag. I don't know if you've seen that one. So I think that's a technique to try and focus on your breathing. I remember when I had that panic attack, it was quite a difficult one because I was in a car and I get like motion sick as well. So so it was like just exacerbated how I felt, but definitely focusing on breathing in through the nose, breathing out through the mouth helped to try and keep my thoughts under control, if anything. So yeah, and are there any that you tried when you experienced a panic attack there, Matt?
No, and at the time, I think knowing this might have helped me to
Yeah.
at least tackle it. I think that, so I didn't actually try any of them really, and I kind of wish that I'd known about it to have been able to try them,
Yeah.
because I think they might have helped.
Hindsight's a wonderful thing, isn't it?
Yes, definitely.
Having this, and to be honest, one thing that's really, I can't remember who I was reading it from, but eye movement is a big thing in helping you to relax. So I've noticed that staring just at a spot, like say for example, you literally just stare at the same thing, your thoughts aren't as racy. You kind of like stop thinking. So that might be a method as well that people can use. So if you're having I know it's quite hard to do in the situation to rationalize what you're going through, but if you just stare at a spot, your thoughts kind of like freeze. It kind of blew my mind when I tried it for the first time. So yeah, that might be another one to add in there as well. If you're having a panic attack, just try and stare at the same thing and breathe deeply, and that might be able to mitigate some of the symptoms. So yeah, that's some really useful one. Just to recap, you can focus on your breathing, stamp on the spot, focus on your senses, or try grounding techniques as well. So that's how to nip it in the bud when it's actually happening and occurring. Easier said than done, of course, but there are some longer term treatments for panic disorder as well. So treatments for panic disorder aim to reduce the number of attacks that you have and ease your symptoms as well. So as always, we do recommend speaking to your GP or a health professional before pursuing any of these treatments yourself. And like I say as well, these treatments are for panic disorder more in particular, rather than treating an individual panic attack. So first of all, we've got psychological therapies or a specialist referral. So one of the therapies that we talk about a lot to do with anxiety is cognitive behavioral therapy. And this could be a suitable treatment option for panic disorder. It largely involves discussing your reaction to the panic attacks that you experience and just learning about the ways of changing your behavior during these attacks to mitigate them. So typically, if you sign up for that psychological therapy, you have one-to-one sessions with a therapist, but you might have them in a group as well. That can happen. Alternatively, if psychological therapy such as CBT aren't actually working, your GP may refer you to a mental health specialist, such as a psychiatrist or a clinical psychologist. I think that's interesting. So I can imagine that if it says there about the CBT that you discuss your reaction to the panic attacks, I can imagine that what you might speak about is using some of them techniques to try and stop the panic attack. So maybe thinking about how you reacted in that situation, and then maybe saying, well, next time, why don't you try focusing on your breathing? And maybe when you try that stamping on the spot. So it's coming up with them ways to try and change your behavior and mitigate that panic attack. That's the psychological therapies or specialist referral. Matt, we also have medicines as well.
We do. So as we mentioned, it's really important that you speak to GP about your anxiety as a whole, but you've got to look at the broad picture. And this is, before you go down the route of medicine to help you deal with it. But there are a couple of common medicines out there. So you've got selective serotonin reuptake inhibitors. There's also something called
I always stitch you up with this medicine one.
Valin or clonazepam. There are medicines you can take. A few common ones, selective serotonin reuptake inhibitors is one as well. So there are medicines that you can take. There's also a form of sort of anti-epilepsy medication that you can take as well to help treat anxiety and panic disorder. But like we say, you should always speak to GP about this. They are trained to do that. So it's best to have a discussion with them before you think about even the type of medicine that you would take. But there are things out there that can help.
Yeah, definitely. And it's probably for more severe forms of panic attack. Because obviously, like we've spoken about, some of the symptoms are really uncomfortable and severe. So, anti-epilepsy medication, for instance, would probably be a good way of mitigating them symptoms and keeping them under control. But finally, as well, we have self-help therapy, something that myself and Matt are big advocates for in all kind of forms of your mental health. You can take proactive measures to treating a potential anxiety disorder that you might have, and this is the same for anxiety and panic attacks. So there are some lifestyle changes and conservative methods which can be taken to prevent panic attacks from occurring. I'm just going to reel off a few of them. So self-help books, based around coping mechanisms like we've spoken about, and techniques for what to do when a panic attack occurs. Of course, being more mindful and aware of different techniques will be so useful. I mean, like you just said there, Matt, we didn't really know about how to stop a panic attack, but maybe if we'd have known about that prior to the panic attack occurring, that might have taking it from a 20-minute panic attack down to 10 or even 5 minutes, trying to get it under control. So yeah, self-help books can be really useful. Also relaxation techniques and therapies. So enrolling in activities like yoga and Pilates as well, and practicing some breathing techniques as well. We talk about that in some of our another one of our articles, which is applied relaxation, which is a really good method of keeping your anxiety under control. Also, big advocate for this one, although quite ironically, I had my panic attack after the gym. So, just be mindful with this one. Taking up regular exercise, physical exercise, in particular aerobic, can help to create kind of like a natural release of serotonin and help to relieve tension and stress. We all love that sweaty feeling after a workout, don't we? So that can help you to relax a bit more. But just be mindful with the amount of exercise you're doing, because you don't want to push it too far and then cause a panic attack, which of course in my instance I did. And then finally, controlling your intake of certain foods and drinks and other substances. So Matt, maybe this one applied a bit more to yourself with the caffeine intake. So just watching your caffeine, alcohol, nicotine and sugar intake as well can be really useful. Interesting. Very interesting that. Looking at it, we can see we can pretty much show that two of them would have helped us with our panic attack onset, being caffeine, maybe me not pushing myself with the exercise too much and just focusing on the breathing and relaxation might have helped us. So hopefully, if you've had a panic attack before, or you have an onset of one in the future, this can really help you to mitigate that and prevent it from happening. Bit of good pod today. It's been really interesting. Just to recap what we've spoken about. We've given a definition of what a panic attack is, also distinguish between panic attacks and panic disorder. We've spoken about the symptoms of a panic attack, how it feels, and also how long they can last. Also what causes a panic attack as well. Some common themes there. Finally, we spoke about how to stop a panic attack in its tracks and the treatment options for panic disorder as well. And of course, me and Matt, spoke about a couple of our personal experiences as well. So hopefully that can, I suppose, normalize what a panic attack actually is, and just show how common it is for it to occur and for it to happen. But yeah, nice one. It's been a good pod. Definitely. And Matt, what can people do if they want to find out a bit more, or feel like they need to have an intervention for panic attacks or panic disorder?
Yes, I think it's always important to know that, if you are suffering from panic attacks or panic disorder, you can get help. You can get help today if you want to get a page on our website, which can help, gives you a link to Anxiety UK and also Mind as well. And it's things that you can do to get help. So if you want to take that step, we have the resources there for you to go and do that. And also, you can also speak to your GP to seek advice as well, which is always a recommended step as well there.
Yeah, brilliant. Well, I'll tell you what, I think I'm going to need some of them breathing techniques for Sunday, the big old Euro final, not going to lie. Got to definitely have to focus on my breathing a little bit and cut out the caffeine intake. That's for certain.
Yes.
But no, some really useful tips there that hopefully our listeners have found really useful. So thank you very much for listening. Hopefully we will, obviously, you'll visit our next podcast, which will be episode 5 of the Anxiety Explained series. Visit the website, share it on if you find it useful and think someone else can benefit from it. And yeah, thank you very much for listening. Have a lovely day.
Thank you for listening to the MindKeepers podcast.
Our purpose is to ensure that anyone who needs help takes the steps to get it.
Break the stigma, take the step.